So today I've been assigned to a patient who has a UTI, and I'm going to be following the following procedures: an IV push, a primary IV bag, and a secondary IV piggyback. I have gathered all of my supply, and I'm going to be performing all three procedures at bedside. I'm going to walk to the patient's room. Patient is on standard precautions. Knock, knock. May I come in?
Come in.
Provide some privacy. I'm going to wash my hands here. Hi, my name is Vanessa. I'm going to be your nurse today. How are you doing today?
I'm okay.
Okay, may I ask what your name is?
Arena Tract.
And your date of birth?
2/6/2000.
All right, happy birthday. Do you have any allergies?
No allergies.
No? Okay. So I am here because I need to administer some medications, with one being ondansetron for your nausea and vomiting related to an antibiotic medication called cefazolin, and that's for your UTI, and it's going to be infused in a 0.9% sodium chloride. Are you okay with me to proceed?
Yes.
Okay. So I'm going to grab some gloves, and I'm going to check the IV site. Okay, Tegaderm is dry and intact. No redness, irritation, or infiltration on the patient's arm. The IV line looks good. I'm gonna come over to my computer, and I'm going to check the MAR, and the order states ondansetron for Arena Tract. The dose is 4 milligrams every 8 hours, PRN. The route is IV push. The time is to give now, and it is to be dispensed at 2 milligrams per milliliter. So I'm going to grab my medication vial, and it is ondansetron. And I'm going to check the color, the clarity, and the expiration date. Looks good. I'm going to scan it into the MAR. I'm going to scan the patient's wristband. Okay, and now I'm ready to prepare my medication. I am using a 3 ml syringe. And I'm getting my needle here and do a sterile technique. And I'm going to aspirate some air into the syringe. And I'm going to then swab my vial for 30 seconds with alcohol. Remove the cap. And I'm going to pin my vial, inject the air. I'm going to flip it over, and I'm going to dispense into my syringe the amount that I need, about 2 milligrams there. All right, and I'm going to take the bubbles out, check the volume at the meniscus. Looks good. Put the vial back down, and I'm going to single cap my syringe, and I'm going to label it. But since I'm at bedside, I would normally you would have to label it in the medication room. So I have said the right patient, the right dose, the right route, the right time, and I documented. And I'm verifying at bedside that I'm giving 4 milligrams of ondansetron that is dispensed at 2 milligrams per milliliter. Okay, so I'm going to need normal saline and alcohol swab and some, and some hubs. So I'm going to start off with clamping my IV site. Put it in between my non-dominant fingers. And I'm going to swab the hub for 30 seconds with an alcohol wipe. Grab my normal saline syringe. And I'm going to attach it to the hub, sterile technique. Unclamp. And I'm going to deliver at a rate of, 3 to 5 ml of syringe. But before I do so, I'm going to check the patency of the IV site. So I'm going to pull back. Looks good. And now I'm going to dispense the 3 to 5 ml into the IV line. Okay, I'm going to clamp it. Remove the syringe. And now I'm going to grab the syringe that contains the ondansetron medication. I'm going to sterilely remove the needle and attach to the hub. And I'm going to unclamp and deliver this medication at a rate of 2 minutes. Slowly. Okay. Then I'm going to clamp, remove, and I'm going to flush my medication so it won't stay, so the medication won't stay in the line. Attach it to the hub, unclamp, and I'm going to administer this medication at the same rate that I did with the ondansetron, and I'm administering 3 to 5 ml. Okay, I'm gonna clamp, remove, and then I'm going to grab a cap that will protect and sterilize the hub. And I'm going to collect all of my trash. And I'm going to dispense my needle in the sharps container. I'm going to remove my gloves. I'm going to then wash my hands. And I'm going to check the MAR again because I'm going to be administering now the primary IV bag. So I'm going to check the order, and the order states 0.9% sodium chloride for arena tract. The dose is continuous at a rate of 125 ml an hour. The time is to give now, and the route is IV, and it is dispensed at a 1 liter bag. Okay, so I'm going to put on some gloves. And I'm going to check my bag's color, clarity, and expiration date. Looks good. I'm going to scan it into the MAR, and I'm going to scan the patient's wristband, and I'm going to then label it with the route, the time, my initials, and it's for arena tract. Okay, and then I'm going to open my primary IV set. And I'm going to clamp to avoid spillage. I'm going to keep everything single-handed here. I'm going to then remove the rubber and remove the cap and keep a sterile technique here. Flip it over. I'm going to hang it. I'm going to fill my chamber halfway. Untangle my line here. And I'm going to prime it and make sure that there's no bubbles. Okay. And then I'm going to come to the IV site and I'm going to remove this cap here. Swab for 30 seconds. Remove the cap and attach using sterile technique. Unclamp. And now I'm going to adjust the rate here using my roller, and it is going to be 21 drops per minute, and I'm going to calculate that in 5 seconds per 5 drops per 15 seconds. And the way I calculated was volume divided by time in minutes times the drip factor that was on my IV set. So I'm gonna do 5 drops per 15 seconds. Okay, looks good. And I'm then going to label my tubing with the time, the date, and my initials. Okay, looks good. I'm going to remove my gloves and I'm going to wash my hands. And now I'm going to go back to my computer. I'm still here at bedside. So I'm going to check my order for arena tract, and I'm going to check in the MAR. And now I'm going to administer the cefazolin that will be infused with the 0.9% sodium chloride for the patient's arena tract. And the dose is 500 milligrams to be given every 8 hours. And the route is IV piggyback. The time is to give now. And I need to give it over 15 minutes. Okay? So I'm going to then put my gloves on. And I am going to take my medication, check the color, the clarity, and the expiration date, and no damages to the bag. I'm going to scan the medication. I'm going to scan the patient's wristband. And I'm going to then label it with the medication name, the dose, the time, and my initials, and it's for arena tract. I'm going to open my secondary medication set. I'm going to first take out my hooker, and I'm going to lower my bag, hanger, this is a hanger. I'm going to grab my hanger, and I'm going to lower my primary bag. Just like that. And then I'm going to open the rest of my packaging, making sure I clamp. And then I'm going to label my tubing with the date, time, and initials. Okay, I'm gonna move everything out of the way here. I'm gonna grab my antibiotic, flip it over upside down. And I'm going to remove the rubber, and I'm going to remove the cap. And I'm going to sterilely attach it together, twist it in, flip it over, and hang it above your primary bag. And then you're going to fill your chamber halfway. Okay. And then you're going to then grab your alcohol wipe and find the hub that is closer to the chamber. I found it, so I'm going to wipe for 30 seconds with alcohol. Sterile technique, remove your cap and attach it to the hub, just like that. And then you're going to unclamp the first one from the secondary line, and you're going to control your rate on your primary line. And the rate for the cefazolin is 33 drops per minute. I'm going to calculate it by seconds, by 15 seconds, so that would be 8 drops per 15 seconds. So here we go. I'm going to grab my roller here. 15 seconds, 8 drops. Okay, looks good. All right, so then I'm going to, so everything looks perfect. I'm going to remove my gloves and I'm going to wash my hands. I'm going to lower the bed. Are you comfortable, Rena?
Yeah, I'm good.
Yeah? Okay, so here's your call light. You okay, right?
Yeah, I'm good, thank you.
Yeah, okay. All right, I'm gonna wash my hands. I'm going to leave the room, and I'm gonna go to the nurse's station and go into the MAR, EHR tutor, and document all of my medications.
Perfect.